To avoid condensation from the cooling cap freezing in the patient's hair, a paper hat is first placed on the patient's head. The cooling cap should be pulled well over the patient's head. It is important that the cap fits to the head as tightly as possible for maximal cooling effect. The strap should be fastened under the patient's chin and padded with 2 sponges. The patient can adjust it for maximum comfort. The strap should be tightened so that the cap sits as closely as possible. To keep the patient's ears and forehead from the cold, they can be protected with sponges. Place a towel under the tube in the patient's neck to protect it from the cold. The patient is now ready for treatment. Turn the pump off on the machine and connect the cooling cap. Turn the pump on again. Cover the patient with a blanket for warmth. The patient should wear the cooling cap for 30 minutes before starting the chemotherapy infusion, during the entire infusion, and for 1.5 to 2 hours after the infusion is finished. If the patient must use the restroom during the treatment, turn off the pump and disconnect the cooling cap. The cap should remain on the patient's head when using the restroom. After the treatment is finished, the cap is removed, along with a paper cap and sponges. The cooling cap is washed in lukewarm water to remove any frozen condensation and to clean it for the next patient.